I have to say that the other side of this coin was the duty to make sure that our workers were safe. And I will tell you, in the early days of this pandemic, facing some of the things that we saw, our first instincts were to make sure we were protecting our workforce. We weren't going to be able to care for anybody if we lost our workforce. And I think you see examples across the country where when that attention wasn't paid to worker safety, there's no chance of preserving patient safety. So it wasn't just benign neglect. It was a conscious effort to say, we have got to make sure our workers are safe. And if that means not turning a patient every 2 hours because it takes 6 nurses to do it in a COVID unit, then we're going to have to, for the moment, figure out how we can modify our standard. How to handle a bladder catheter or a central line in a patient who's prone is not an exercise anybody ever did. So we were clearly in totally uncharted waters. Now, we just weren't capable of learning fast enough how to do that. But I will tell you, in that window of time, we had a duty to protect those workers, or there would have been a lot more casualties than we saw.
I don't think it's either or, though. I mean, I recognize that's true. I think that's a big difference between a hospital like Duke and some others that we watched from a Leapfrog perspective. Now, from our perspective, we looked at numbers. So I recognize we're not on the ground certainly like you are. But I will say that the hospitals that don't have a long-term history of putting patient safety first, of really a laser focus on patient safety as a top priority, that's where the workers really safe. I mean, frankly, when we watched the New York City surge when it first started in the pandemic, I frankly looked at some of the hospitals that have consistently had very poor safety records on every metric we've looked at, not just our metrics, any other metrics, poor safety records. And those were hospitals that were seeing massive casualties from their workforce. And so I think the habits of putting patients first, of focusing on safety constantly, that culture of safety had to have stood you in good stead at Duke. And it has to be part of what we think about going forward and what we learn from, so that we can have a safe workforce. Because absolutely, we have to keep the workforce safe. It's not different from keeping patients safe. These are human beings. We all have to be safe.
Yeah.